Welcome to the chilling true story of the Norton Healthcare ransomware attack, one of 2023's biggest healthcare breaches. BlackCat hackers stole millions of lives worth of data. Today, we uncover how it happened, the massive fallout, and the vital lessons to protect yourself. Like and subscribe for more cybersecurity stories that matter. Let's dive in. May 2023, Norton Healthcare, a major Kentucky and Indiana hospital network, faces disaster. On May 9th, they detect intruders. The attackers, the ruthless BlackCat, also known as ALPHV, a top ransomware crew. Between May 7th and 9th, they slip in, access network storage, and steal sensitive files. Nearly 2.5 million people hit: patients, employees, families. Exposed: names, addresses, social security numbers, dates of birth, diagnoses, treatments, insurance details, pure PII and PHI nightmare fuel. Here's how these attacks unfold. Hackers exploit weak spots, often unpatched software or phishing, then inject malicious code for deep access. BlackCat exfiltrates huge data troves. They claim nearly 5 terabytes, encrypts critical files, and demands ransom. Refuse to pay, they leak it all on the dark web to force your hand. Double extortion at its worst. Healthcare's a prime target. Medical records can't be cancelled like credit cards, and downtime risks lives, making victims more likely to cave. Why healthcare keeps getting hammered? Legacy systems, constant urgency, and always-on networks create openings. Stolen medical data is gold on the black market, perfect for identity theft, fake claims, insurance fraud, even blackmail. Victims face years of risk, wrong treatments from altered records, fraudulent bills, endless monitoring stress. Worst part, trust shatters. Patients share their most private info with doctors. One breach erodes that forever, causing people to delay care or switch providers entirely. Norton responds quickly, isolates systems, restores from backups, smartly refusing to pay ransom, notifies law enforcement. The FBI launches a hunt for the global attackers. But justice is slow. Lawsuits flood in. Class actions claim negligence under PII rules. Recently settled for $11 million, covering claims up to $2,500 per person plus monitoring. Reputation takes a huge hit too. Millions of patients lose faith, fines loom, and recovery costs skyrocket, proving breaches destroy more than just data. Prevention beats cure every time. Patch systems fast to close holes. Adopt zero trust. Verify every user, every device, always. Roll out endpoint detection tools to catch threats early. Train staff hard. Phishing starts most attacks, so teach spotting fakes, strong passwords, MFA everywhere. Run regular audits, use threat intelligence. Cybersecurity isn't set it and forget it, it's daily discipline. These basics could have stopped Norton's nightmare before it began. The big question: pay the ransom. Experts and FBI say never, it funds crime and paints a target on your back. But in healthcare, lives hang in balance, pressure mounts. Norton's choice: fight back with strong, offline, tested backups, they restored without paying. Build rock-solid disaster recovery. Test plans regularly, minimize downtime. Invest in resilience now, so criminals never hold the power. Preparation turns victims into survivors. This isn't rare. Pandemic chaos boosted healthcare attacks, strained systems, millions exposed yearly. Groups like BlackCat thrive on that weakness. Governments fight back. CISA shares free tools and alerts. Global ops disrupt gangs. If you're affected, act now. Monitor accounts, freeze credit, add fraud alerts, watch for scams using your data. Vigilance protects you. Awareness is your best defense in this rising threat wave. Final lessons from Norton's story: threats evolve fast, so must we. Team up, organizations, governments, everyday people. Layer defenses, tech, training, quick response, unbreakable backups. Stay proactive, test everything. One weak link can cost millions. Cybersecurity is everyone's responsibility. If this hit home, comment below. Ever checked if your data's been leaked? Share this video to spread awareness. Subscribe for more real threats and real protections. Stay safe out there.